Hello, Dr. Vikki Petersen here. I want to speak to you today about screening for celiac disease and really discuss the topic a little bit and see what your thoughts are. A study was released last week on this very topic, and what they looked at were sort of the pros and cons. So in a nutshell, in order for a disease to meet the criteria to screen the population, it has to be common, it has to impose a significant health burden, and it has to be treatable. So I think you would agree that celiac disease definitely does this. It is the most common lifelong disorder in the United States and Europe. It definitely imposes a health burden. It's associated with 300 different diseases and conditions, and it's absolutely treatable. We can remove gluten from our diet. If you watch these videos at all, you'll know that I feel in my clinical experience it's certainly validated that simply removing gluten from the diet is usually not enough, we find in our patients, and treating the secondary effects is extremely valuable and necessary. And I think that philosophy or thought is really corroborated by the fact that only 8% of celiacs fully regain the health of their small intestine. So if removing gluten was the be-all end-all, then the result of the percentage of celiacs that were fully healed would be much, much better than 8%. So why should we screen? We've realized that celiac fits the criteria of a disease to be screened. So what else is in the corner of why we should do it? It affects, at 1%, it's extremely common, but we know from Dr. Fasano's work last year that with age, the incidence of celiac disease actually increases to 4%, so that makes it extremely common as a disorder. Gluten sensitivity, sort of a cousin to celiac disease, affects anywhere from 10 to 30+% of the population. The research in that area is just beginning, but conservatively 10% is what a recent study showed. Certainly the fact that we only diagnose 5% of those suffering from celiac disease is a travesty. It's a very serious disease, as we mentioned, associated with 300 different diseases and disorders, yet we only find 5% of those suffering. So screening would definitely enhance that. Now, as far as diseases and disorders, we could talk about depression and anxiety. We could talk about infertility. We could talk about migraines. There's a lot of different things we could mention, IBS, that gluten is known to be associated with. But let's focus just on one, which is autoimmune disease. Celiac in itself is an autoimmune disease, and it is associated and interrelated and causative of other autoimmune diseases. Where you have one autoimmune disease, you have others. And the importance of this is that all the autoimmune diseases, and there's over 100, but if you take them together, they're the third leading cause of death in our country. So imagine screening for celiac, that autoimmune disease, and knowing that where there's one, there are others. Imagine the dent that we could make in lessening the number of autoimmune diseases developed by doing a good screen. So now on the con side of screening, you have some very good questions. Or do you have a good test to diagnose this disease? And of course, well, not of course, but the unfortunate truth is it's not as good as it needs to be. Our celiac test that most gastroenterologists and your general practitioners use is not very sensitive. As a matter of fact, way too much damage has to occur in the person's body for that test to show positive. There is a new laboratory, Cyrex Labs, that came out this year that has a much more sensitive test. Is it perfect? No. Is it much better than what we've had? Absolutely. So that needs to be looked at. There's also the fact that if you're going to look for celiac disease, you also really must look for gluten sensitivity, because they're both associated with an extreme amount of disease. So you can't just screen for celiac, you really have to screen for both. So that has to be part of the problem, or part of what we need to confront in order to really look at that. And then lastly, there's the cost. But if you look at the cost of a laboratory test compared to the cost of treating all the diseases that gluten sensitivity and celiac cause, it really doesn't take long to figure out that a screening is well worth your time when we're literally talking about at the most conservative 15% of our population suffering from this. If you put together the 4-ish% suffering from the celiac and the most minimally 10% suffering from gluten sensitivity, which I, in my heart of hearts, believe is much greater than that based on clinical experience and the clinical experience of many fellow clinicians who specialize in this. We're looking at a big portion of the population suffering here. So I'd love to hear your feedback. Just as a closing comment, if you want to be screened and you're having trouble getting your doctor to do so, or all your doctor will do is the most conservative celiac test that maybe he or she is not aware of the gluten sensitivity test, sure, if they're willing to do the celiac test, get it done. But if it's negative, realize you may still have celiac, you may still have gluten sensitivity, and if that's the only tool at your disposal, remember you have one more tool that's very, very easy to do, and that is simply, and I don't mean it's simple, but it is free. And this is one thing that you do, and that is you yourself go on a gluten-free diet, religiously gluten-free, as 100% as you can muster for 30 days. And if at the end of that 30 days you feel better, realize that's a positive test right there, and you don't really need anything else to tell you that. So I hope I gave you some tools here, hope I gave you some food for thought, and do let me know what your thoughts are. Until next time, I wish you very good health.